All of our joints, knee, shoulder, elbow, ankle, all of our joints are lined with cartilage. As I talk about it in the office with our patients, cartilage is often the same thing you see on the end of a chicken bone or a beef bone, the white shiny material. We have that same material on the end of our bones. So literally the cartilage, especially in our knee and our hip and our ankle, which are weight-bearing joints, it provides a cushion as we walk or run or jump, and also a phenomenally smooth gliding surface with very little friction, so that when we move our joints, there's not much stress or resistance. Arthritis, in general, as a general definition, is a loss of this cartilage. So when the cartilage gets worn away, either it gets thinner, so it's not as thick as it used to be, it provides less cushion, or you get potholes or pitting of the cartilage where you lose, as if someone take a watermelon scoop and scooped out the cartilage, or you have areas where you lose all the cartilage and you get exposed bone. The end stage, which unfortunately does happen in many people, is bone on bone. We hear that as a common term in the media. Bone on bone arthritis is, as it sounds, the complete loss of cartilage. So that literally, as the knee moves, as the ball and socket of the hip or the shoulder move, that you have bone rubbing on bone. It's a system where there's a lot of friction, a lot of grinding, and very little cushioning, and that's what causes pain. I think it's less well appreciated in the public and outside of orthopedic surgery, really, that shoulder arthritis is an extremely disabling condition. The shoulder is not a weight-bearing joint like the knee or the hip or the ankle, so we don't think of arthritis in the shoulder the same way we do in the hip and the knee. Shoulder arthritis is a condition that tends to get worse over time, whatever the cause was. It causes increased pain, stiffness, loss of motion, and weakness. And as you can imagine, our shoulders are very mobile joints, so that can lead to pretty significant disability in athletes and people who require overhead motion to work. And then even for everyday activities, whether it's reaching up from a shelf, many hobbies, shoulder arthritis can be a very disabling condition. I feel as if there needs to be more awareness about shoulder arthritis. Even my patients, who are very often diagnosed with this problem by referring physicians over, myself, sometimes look surprised at the diagnosis, as if that even exists, or how they can possibly get it when they've never had an injury to their shoulder. There are many patients who never had a problem in their life and come in with a few months of pain thinking they need a cortisone shot, or there's a simple problem and they have pretty extensive arthritis in their shoulder.